I think it's important for students to understand the history of nursing, understand Florence Nightingale and what it took, how it changed nursing practice, how it changed the whole field and began a whole profession that did not really exist much before.
Florence Nightingale's revolutionary efforts brought order to the processes of 19th century nursing. These were the duties of a nurse in 1889. Daily sweep and mop the floors of your ward, dust the patient's furniture and windowsills.
In modern nursing, we have housekeeping that comes and does all that stuff.
We definitely do not mop or dust window seals.
We just call housekeeping and they clean it all up.
The nurse's notes are important in aiding the physician's work. Make your pens carefully. You may whittle nibs to your individual taste.
Whittle my nibs. Yeah, we do computer charting at most of the hospitals.
We do have pens and pencils, and we do write up lots of notes and care, but a lot of it's transformed into the technical world, so a lot of our notes and things are on the computer.
Computer charting is pretty complicated, so it'd probably be a lot easier to make my own pencils and write it down on paper.
Each nurse on day duty will report every day at 7 a.m. and leave at 8 p.m, except on the Sabbath, on which day you will be off from noon to 2 p.m.
My normal routine is getting up at 5 a.m, being to the morning shift by 5:45 to get just the morning rounds and stuff done.
Nurses generally in hospitals work 12-hour shifts, so it's usually 6 a.m. to 6 p.m. and then 6 p.m. to 6 a.m. for the night shift. And new nurses generally have to start out with the night shift, and they have to work weekends and holidays in the night shift.
I would like to have Sundays off, but I don't see that in my future, because usually the nurses with the lowest time there always get the weekend shifts.
Graduate nurses in good standing with the Director of Nurses will be given an evening off each week for courting purposes, or 2 evenings a week if you go to church regularly.
That's great.
Any nurse who smokes, uses liquor in any form, gets her hair done at a beauty shop, or frequents dance halls will give the Director of Nurses good reason to suspect her worth, intentions and integrity.
Usually nurses are too busy for dance halls and beauty parlors, but if we did frequent those places, we probably wouldn't lose our jobs.
I don't know, I think that the quality of a nurse isn't defined by maybe how they live their outer life, but it's how they treat their patients and how they work in the hospital with other individuals.